Hello, everyone. My name is Mike. I'm a physical therapist and your host of the Health Me podcast. Thanks for tuning in, and remember to leave a like and subscribe so you don't miss any updates. During this week's episode, I had the amazing opportunity to sit down with a researcher out of the University of North Carolina, Wilmington, to discuss not only concussion, but to learn about an amazing new platform or concussion ecosystem called Sport Gait. Their aim is toward concussion analysis, monitoring, and treatment in order to protect, educate, and connect athletes. Currently in the United States, there are approximately 7.6 million concussions that occur over a year, with a larger majority of them going unreported. This new healthcare ecosystem within SportGait is extremely helpful and seeks to aid all parties involved with the management of concussion for an athlete. For those unfamiliar with concussion, there are many people contributing to the overall treatment and recovery process for concussion, including athletic trainers, parents, doctors, and even physical therapists. Nonetheless, SportGait is providing a unique tool by creating a platform for everyone to access and utilize for the benefit of the patient. Prior to understanding SportGait, our guests will get into all the specifics of what a concussion is, how we identify symptoms, and answer other questions that may be of value down the road. Additionally, we will seek to better understand why symptoms in concussion are so variable and why loss of consciousness can be a big indicator of severity of injury. You may already know this, but research within concussion has exploded over the past several years, so it was amazing to have someone on the podcast who is well-versed in this growing area. To highlight a little bit more about our guest, he currently runs a research lab emphasizing the factors that influence decision-making in different settings, and has ongoing research projects that include assessment of memory function with an emphasis in early detection of memory problems like dementia. It was a true honor to have him on the podcast, and be sure to check out all of his published work as I linked his information below, as well as SportGait. Here is my conversation with Dr. Len Lecci. So I kind of wanted to get everyone on the same page here and talk a little bit about your journey, how you got into healthcare, as well as, where your curiosity began with concussion.
Sure. Well, actually, the interest in concussion specifically occurred back in 2016 when I was contacted, actually our chair of our department, who was working with the Center for Innovation and Entrepreneurship at the university. I'm a professor at the university here, a clinical psychologist. And there was a company called SportGait that was embedded at our Center for Innovation and Entrepreneurship, and they were looking to make some connections with people who had some expertise in assessment. That's kind of I'm the sort of assessment person in our department, and also had interests in brain, mild traumatic brain injuries, etc. So that's another area that I've carved out, not necessarily concussion specific, but just more broadly speaking, brain deterioration, brain disease. In fact, I actually direct a memory center where we focus a little more on older individuals and as they're experiencing memory changes. So this was a little bit of a shift for me, focusing on what are largely under 18 athletes, the work they were doing at the time, but still well within my interest wheelhouse of measurement and such. And so that's kind of really the first connection that happened. That was back in 2015, 16, and started meeting regularly with the team out there. And then that kind of launched a whole research consortium we have here at the university that's focused on now concussion.
Interesting. Now, what has the research been like over the past few years in regards just, as people have been learning more and more about it? Has the research been more prevalent? Is there, more and more coming out about concussion? I guess, have you seen a large increase in the amount of research done on concussion?
Yeah, absolutely. I mean, save for the period, the sort of COVID flattening of the curve where things kind of slowed down a bit. We couldn't do as much in-person stuff, but prior to, and again now, big interest in concussion, and really sort of a resurgent interest, because it sort of hit the radar, probably about 15 years ago, 20 years ago, with some changes to start quantifying the consequence of concussion. But, whether we're talking about movies or just stories from professional leagues, et cetera, you almost couldn't pick up certainly a newspaper or something and see a major story about it. And behind the scenes, all of these longitudinal studies, major studies that have been under the works, they were really just starting to come out with their findings. So it's been kind of an explosion of research in that area in the last decade for sure, with an acceleration really in the last few years. So lots of new work coming out and changing ideas about what we mean of concussion. So hopefully we'll get into that a little bit now, sort of how we think about it today than even just a decade ago has changed tremendously.
Sure. Well, maybe before we get into like how it's changed, I guess, how would you define a concussion? Like what would it, for layman's terms, I guess, like how would you mostly define what a concussion is?
So a concussion for layman's terms would be essentially a blow either to the body or to the head, although we typically think about it as the head, but even taking a blow to the body can result in the head moving in such a way that it creates a concussion. The sort of technical term you often see is a traumatic brain injury, TBI for short. And the vast majority of these injuries are what we would classify as mild in nature, mild traumatic brain injury. That's 85% of brain injuries fall in that mild category. And when we talk about sport-related concussions, those are almost exclusively in that category as well. It's pretty rare that we see some of those higher level ones. It typically means that there's been some disruption in the brain that can be that sort of a blunt force trauma, as well as some other consequences. So there's a wide range of symptoms people experience, things like headaches, maybe light sensitivity or even noise sensitivity. You might experience some nausea or vomiting. There are some other symptoms that other people might notice, like one pupil being larger than the other, as an example. But this constellation of symptoms often sort of hit their peak sometime within about the first 24 to 48 hours after the incident. So that meaning you might feel okay initially, but the symptoms could actually uptick in those next 24 to 48 hours. And then in the weeks to follow, those symptoms usually will start to abate, decline with time. It can vary. There are certainly we hear of long haul COVID. There's certainly some long haul concussion folks who don't recover very quickly. But the vast majority of them, several 3-4 weeks in, will have experienced most of the recovery. They may still have a few lingering symptoms, but most of the symptoms will have resolved at that point in time. And that's just kind of in general rule overview. Always direct people to the CDC website. There's some great resources on concussion, the actual symptoms that you can go through. And of course, they now have a Sport Gait app that runs through all the symptoms. You can actually check for yourself if you'd like.
Yeah, and we'll go over the specifics of symptoms and how it relates to concussion a little bit later. But I kind of want to also ask you, are there different types of concussion similar to like sprains? There's grades 1s and grades 2. For someone who has a concussion, are there different concussions that you can sustain?
There absolutely are. So it's not quite as formalized as some other injuries because part of the literature is still evolving on what we mean by different kinds of concussions. But a few things to keep in mind. So they vary in their severity. So we do have, mild, moderate, and severe injuries of that nature. They can vary in terms of how diffuse they are. So depending on the nature of the injury, it might affect a larger portion of the brain versus a more localized portion of the brain. So, think of the example where someone takes a blow that's in a very specific region, perhaps the bar fight breaks out and the pool cue gets knocked over your head in a very specific spot, versus a much more broad injury where a larger portion of the brain is affected, perhaps even the head goes back and you get like a rebound effect on the back of the skull as the brain sort of sloshes to the back. You can have some shearing on the side. It's kind of a graphic image of thinking your brain kind of shearing itself on the inside of the skull, but that can happen as well. And that shearing can clear off some neuronal activity and firing. So you can really have some really diffuse damage. And of course, you can have sustain multiple hits as well at the same time. And I'm trying to be not too specific to say sports, car accidents. You can think of like a bomb going off for in military or something of that nature, where you might have concussions both from the blast and then your head hitting the ground as you hit the ground. So a lot of different ways this happens. And while these are always the kind of graphic images we think of, the most common causes are slips, trips, and falls. So they're the very mundane, like you're on your way to the bathroom, you trip on the rug, and you hit your head on the bathtub. That's by far the most common types of concussions that people experience, not necessarily your elite athletes or anything, just the opposite almost. And that then parallels the kinds of symptoms you'll experience. And there's also been some recent work, working groups that talk about the concussions being organized by the symptoms that manifest. So you might have like an ocular concussion where the visual system is the main thing affected, or one that's more focused on, say, changes in your balance or your gait, or some that are mostly cognitive, where your ability to process thinking. And so they also categorize concussions that way for the main reason of treatment, because the idea being that you might focus different types of treatment for those different areas that have been compromised.
Now, at a cellular level, I kind of want to maybe just think about like what, for those maybe who are providers who are listening to this and they're like, for instance, if you bump your elbow, you get a bruise, right? You get this response to your arm where you see increase in swelling. Does that also happen in the brain? Like when you hit your head, do you get this increase in swelling? And then like, what does that look like maybe at a cellular level in regards to disruption in brain function?
Yeah, that's a great question. So let me first just tie this back into the fact that I said that the vast majority of concussions are those mild traumatic MTBIs.
Right.
The reason that's actually really important is because one of the hallmark features of mild traumatic brain injuries is that if you were to do imaging or things of this nature to sort of see what's going on in the brain, you generally get negative findings. That's one of the things that differentiates a mild injury to some of the moderate or more severe ones, where you might actually, do some imaging and see some damage. So what that means is with the vast majority, let's say 80 to 85% of these injuries, it's not like you're going to run it in like an x-ray and see the fracture or something very obvious. That doesn't mean that there hasn't been some structural changes, just that they're subtle enough that they're not necessarily picked up on most standard imaging. And I'm not just talking about x-rays, I'm talking about MRIs, etc. In fact, MRI is sort of the imaging method of choice in terms of its availability and its resolution. That's obviously much higher than, say, a CAT scan, for example. Sure. But oftentimes you won't see anything there, but the person will still be experiencing those symptoms, and that's usually what puts it into that definition of that mild category. But what we do know is likely to have occurred. You did mention sort of bruising on the elbow. There can certainly be some bruising and some swelling, although if it gets to the swelling point, that usually brings it out of the mild category. That usually is something that's more pronounced. And in fact, that can be very serious, where the person might have to, actually surgically relieve some of the pressure. Those, again, are much higher grade injuries. If you experience like a brain bleed, again, a much higher injury. In fact, for anyone listening right now, that's one of the most important reasons why you want to go through some of those, what we call the emergency signs, the danger signs of concussion. There's 11 of those symptoms. If you've got those, you need to be headed to the ER, because if you've got a brain bleed and you're at home, that's not a very favorable outcome. If you want to survive, you want to really be at a hospital when that happens. But the vast majority of these concussions are those lower grade ones where we really don't necessarily see any markers. And so the symptoms become the markers. So when you tell me, yeah, I'm seeing double and the light is like blinding me, those symptoms are really the indicators, much more so than anything I might see in terms of, some neurostructural changes that we might see on imaging. Now, having said that, we do see consequences of that. So we can give you cognitive tests and we see your processing speed slows and such, but that's a little different from actually visually depicting these kind of milder versions of injuries.
So I just want to kind of recap. So although, an MRI may not show that there's like physical damage, because you're experiencing these symptoms and there's a associated head trauma, you can automatically get to the conclusion that you do have a concussion and you're sustaining an injury from that.
Correct. That's a great summary. Yes.
And, how does it differ from like maybe like a skull fracture or maybe like an actual like head trauma can you get a concussion and have a skull fracture at the same time? Or is it mostly like, oftentimes do we see concussion like by themselves, or are they accompanied with another injury?
So the majority are those mild ones, but they're not accompanied. But yes, you can have, of course, the skull fracture. So you can have, literally an open head injury. Those again tend to be not in that mild category.
Right.
And I'll refer to a little psychological phenomena. The availability heuristic tells us that we tend to, when we think of anything, we think of those more extreme sort of cases.
Right.
And there's a few examples of them, but their incidence is, of course, really, really low. So, as far as if there's doctors listening, health providers, they're dealing with those mild versions all the time, whereas, those more severe ones. And truthfully, diagnosing those most severe ones is not that hard, because the person's coming in, there's a skull fracture, you can see that, and clearly when that happens, there's a good chance there's some significant trauma having happened to the brain as well, enough to have cracked the skull, obviously. That tells you something occurred. So it's the other ones that really fly under the radar. In fact, we know we likely underestimate mild traumatic brain injuries. You can imagine if you had an incident, you get up, feel dizzy for a minute, and then you go, well, I think I'm okay. And, the only thing that's really going to drive you to the doctor or to a hospital is if the symptoms get worse, or bad enough that you can't function. If you're kind of like, I've had a headache for a few days, then it went away, you likely had a concussion, but maybe made the call that it's not worth the time and the energy and the copay and all the other things to go see a doctor, especially if in the end they might say, well, rest for a few days, which you may do on your own anyways.
Sure. Well, what's that distinction? Like if I'm a patient who maybe hit their head, or if you're somebody who plays a sport and they hit their head and, it's been like a day or two and they're still having a headache, but they did get hit in the head. So it's like, maybe they just need some time to rest. I guess, is there a distinction or maybe some things that people can look out for to be like, all right, I need to go see somebody?
Yeah. So we always kind of revert back to those symptoms as being critical as people have those symptoms. We also, one of the philosophies that I would say is hopefully a message we'll put across with this podcast, is to try and push these decisions to the medical profession. In other words, I always find it interesting that people sort of become their own doctors, right? They make these calls. And, when you have a big swollen ankle or something obvious in your knee, you can see that. And so, you're thinking, well, I have to go have someone take a look at this. Of course, you can't see these MTBIs, but it's probably the most important part of your body. It's your brain.
Right.
And there's a lot of consequences to either not diagnosing, especially if you then, let's say, have some other incident that happens. And that second incident can be far more mild. So if you've had one and then, literally someone just bumps into you, we see this with athletes all the time. They don't get that first one diagnosed, and then they have a pretty benign contact, and all of a sudden they have like full-blown symptoms because they've had really their second concussion before they recovered from that first one. And then it's really hard to recover. They seem really prone to those concussions again, even though the incidents that trigger them are pretty mild. So one message I would suggest is, I'll sort of shy away from saying, don't go see the doctor. This is the idea. Look, you probably want a medical professional make this call. You might feel confident making the call about your ankle and looking at the swelling. Your brain, I'd probably let someone a little more, from a first or third person perspective, look at it. And then, too, that they actually have a little bit of training in seeing those. If you've got any of those symptoms, it doesn't mean you got to go to the ER, but maybe make an appointment with your doctor or go to an urgent care. It's not necessarily an emergency ER unless you have one of those first 11 symptoms.
Right. And of course it is your brain. So it's what runs everything. So you want to make sure that you don't want to put off, an ankle sprain, you can maybe put off a little bit, but like, this is your brain. Like, please go see somebody if you do have like even a headache for a little bit more than a day. Like it's not something that you want to play around with.
Exactly. And another point gets lost on a lot of people is that, if you've had a concussion, you're not really thinking clearly. And so even the fact that you're going to now make the decision during that point, it's kind of like making the decision whether to drive when you're already intoxicated. That's not really when you're going to be thinking at your best.
Right. Yeah.
That's another thought to keep in mind.
For sure. Well, in regards to symptoms, let's get on topic of that. So when it comes to symptoms, the symptoms are highly variable. There's so many different symptoms that can be associated with it. And I'm assuming that I want to make the assumption that the symptoms are highly variable based on the fact of where you get hit in the brain. But are the symptoms and where you get hit in the brain or where the damage is always correlated to like the symptoms that the patient experiences? Now, for instance, if you get hit in like the top of the head, then is it a certain disturbance with sensory, or is it in the front of the head? It's a certain disruption to like your motor. I guess, is there an association with where the brain is injured and the type of impairments or symptoms that a clinician will see?
Yes, great question. So, in short, the answer is yes, but it's not always the most obvious thing. So let's say again, a common one might be a car accident. So let's say, you have a sudden stop, your head kind of violently goes forward. Let's say for whatever reason, your airbag doesn't deploy. So your head goes forward, you smack it on the dash, and then it sort of comes back. Now on the surface, you of course might pay attention to the big bruise on your forehead, and you think, okay, I've had a frontal lobe sort of contact. What you're not necessarily realizing as well is the back of your brain may have likewise, after it come back and hit the back of the skull, and therefore the occipital lobes are also, which would be a visual consequence. And then, as I mentioned, that shearing on the side, which might be the temporal or parietal lobes, depending on the angle, could also have been affected. So while it's absolutely the case that the location of the hit can speak to the kinds of functional symptoms we see, we often aren't as fully aware of what fully has been impacted because, again, especially with a little more significant trauma, you can see that sort of opposite side or sides affected as well.
So it's important that you're keeping in mind that although maybe a patient's coming in presenting with occipital or eye issues, there may be other symptoms going on, but these might be the ones that you just happen to notice. Am I correct in saying that?
Yeah, absolutely. And patients tend to report their most prominent symptoms, not necessarily all their symptoms. In fact, if a pain is bad enough, you might not notice that other pain until this pain subsides, or at least lessens to a certain degree. And then realize, oh, wow, I'm hurting here as well. And I should mention one other point, and that is a lot of times when people have injuries, they may have other orthopedic injuries and other things that have happened concurrent to that incident. Your neck and spine may have been hurt in that car accident or something of that nature as well.
Now, are there parts of the brain that maybe heal faster than others, or are there, do we see recovery rather quickly, maybe in older parts of the brain than younger parts of the brain? I guess I'm not sure if there are any changes in that at all.
So we don't really have a clear answer on that, and one of the reasons is because our ability to actually measure those the damage and the changes has evolved tremendously just in the last few years. So as that's evolving, our understanding of the very questions you're asking is real. It's an evolving understanding, and so I don't think there's a clear answer to your question. I think it's an excellent question. Do we actually see differential recovery rates? My guess is we will, but we haven't had the tools in place long enough to document that clearly yet. But my guess is if we had this podcast in 2 years, we might have some different answers. There'll be other published studies that would have come out by then.
Hopefully, right? Yeah, hopefully. And one thing that you said you work with is older adults. Do you see a difference maybe in age and how like the recovery is in regards to age and concussion?
Yes, absolutely. So that we do see with essentially, if you're compromised in other ways, you're going to feel those effects even more so. So certainly, when we see older adults have like an incident where they trip and fall, they will that experience might be something that is much harder for them to recover. Just as you see with your body, you sprain your ankle at 15, and a week later you're running around. You do that at 85, and you might not be walking normally again for potentially the rest of your life. So it's the consequences are very different at older ages, and that's true for other vulnerabilities. So people have, for example, ADHD sometimes show the concussion symptoms more to a greater degree and more easily than those who don't. So the vulnerabilities can occur even at younger ages that are other types of brain vulnerabilities.
Are there other factors that maybe lead to longer or a longer prognosis for healing? Like, does hypertension lead to longer time with symptoms for concussion patients?
So we do see this in general with other conditions, but the biggest effects we see are essentially for the biggest conditions. So as you might imagine, like when I said there's an effect for being older, we're probably not going to see it, say, from 30 to 20, but we definitely see it from 20 to 60 or 80. So those effects are probably there. But again, as the instruments are really just now emerging that are even more sensitive to detect some of those more subtle changes, say from 20 to 30 or 30 to 40. I think the answer will be yes, but the data are, again, sort of those things that we're collecting now.
Got it. Now, what are some of those instruments that you maybe just alluded to that perhaps researchers are utilizing to try and capture data? I don't know. I mean, you can't have microbes in people's brains to figure out, what's going on. So
Yeah.
maybe just speak to some of the technology that is emerging or people are using to capture this data.
Yeah, it's really amazing how folks are tackling this from a lot of different angles. So there are some companies, for example, that put devices located on helmets and contact sports and such, where they actually record the degree of the impact. And in many cases, they'll have someone who doesn't get pulled out of the game, but they're saying this one has had the degree of impact that you would expect would have been a concussion. So those would be like missed concussion. So that's one type of telemetry. We're seeing technology growing in that area. We're even seeing it in not direct contact, but in things like in people's mouth guards and such, where they might also feel that same sort of another way to detect that contact. The company, the work we're doing is essentially with devices that measure functional ability. So they monitor gait and balance, your processing speed and cognitive tasks. So again, those are improving tremendously over the ones that, say, have been out 10, 12 years that were great at the time because they were the first measures, of course. But as with anything else, with a little bit of time, people, usually make it a better mousetrap. So they're, it's improving all the time. You have a standard now that you can compare it to. And so all of these are just really scratching the surface of different ways in which we're now capturing the consequence of concussion.
Right. And you're working closely with Sport Gait, and they use very objective data to try and, gather some data. But before we get into those details, I want to maybe highlight other symptoms that maybe aren't always recognizable within concussion. And usually these are often perhaps even like behavior change and even symptoms that aren't really recognizable, where it's like a change in mood and basically the change in emotion. And so how can people look out for those signs and symptoms, and then maybe speak to just are there ways that maybe SportGait or other researchers are trying to capture that and try to look at how this is altering patients, ultimately maybe their prognosis for healing time and so on?
So some of the symptoms may be ones that you wouldn't necessarily notice yourself. So I made reference, for example, to one pupil, being larger than the other. Again, unless you're in front of a mirror, something you might not necessarily notice at that time. Drowsiness is another symptom that we often see. In fact, someone's unable to wake them up. That's certainly not a good sign. Again, it'd be something you'd obviously need someone else to assist with those. Headaches, especially as they get worse, if they're getting increasingly worse or they just don't seem to go away. Sometimes you even see symptoms that look almost like you see with stroke patients, like slurred speech, some weakness or numbness, coordination, decrease in coordination, certainly vomiting, nausea, convulsions, seizures. Those are always red flags if you're seeing some of those. And then, as you mentioned, any kind of unusual behavior, the person looks confused, agitated, restless, highly emotional. Those can certainly be things that you want to pay attention to. Of course, the most obvious one is if you're unconscious. Again, you would obviously need someone else to assist you at that point. But certainly, if you've got someone who was knocked unconscious, I would definitely take them for a medical workup at that point. That's more than severe enough. And the duration of time that you have either unconsciousness or loss of memory. So if you forget, like you remember being hit and then it's an hour later, you don't remember anything, or the duration of the unconsciousness, those are two strong predictors of the severity of that injury. So the longer you're unconscious or the longer you have like a blank period of time where you're not remembering what happened, those are good predictors of how serious that injury might be.
Got it. So if you have an athlete and they get hit in the field and they don't even remember how they got to the hospital, that may be a good sign that the severity of that concussion will be quite great.
Yes, that's correct. And also to put, when I say loss of consciousness, a lot of people think, well, hours and all that. If we're talking really more than a few seconds, that's a serious concussion. So if
Oh,
someone
interesting.
knocked out for a couple minutes, that's a serious concussion. Usually people are, revived pretty quickly. So if you're out for a few minutes, let alone hours, that's a long time. Those would be a big red flag that something serious has occurred.
Now, why does the body go out? Like, is it more of a protective mechanism, or like why is the body's ability when they get hit in the head, the body just like shuts off, like abort, like we're done, that's over, like
Yeah.
you go right to the ground? Like, why is that some kind of like biological drive that's enacting us to try to protect itself, or what's going on there?
So just the unconscious portion, perhaps a little less so, but you are referring to something that does happen. So like when someone goes into a coma, for example, obviously a much more significant injury at that point. That is, in fact, the body protecting itself. So to avoid or to decrease the likelihood of significant brain swelling and such, that sort of shutting down of the system, sort of analogous maybe to someone's phone, you messed it up, shut the thing down, leave it off. Sort of the same idea, and the idea of perhaps even a bit of a reboot at some point. But yes, so at that level for sure. The briefer kind, less so. I mean, that's really just the effect of blunt force trauma, knocking someone out in the way that you would if it was a boxing match and you just got hit in the right spot. So it's really more just the consequence of the direct blow at that point that is likely occurring. But of course, when it happens again to the person themselves, they may not be fully aware of how long they were. It's usually they're looking other people's information to inform them of, how long they were laying there on the floor. So these injuries can be serious. Obviously, if you're by yourself, you imagine a slip, you fall off a ladder, you hit your head in the concrete, and you're laying there. And unless someone comes by and finds you, you could lay there for a considerable amount of time. And unfortunately, that is obviously a very dangerous scenario.
And it can be incredibly scary, especially if you wake up by yourself and you don't know what just happened and time has gone by. It's got to be very awake, very scary at that moment in time.
Absolutely. And then you imagine again how we start going through those self-assessments. So the first thing you might do is, of course, if you put your head back or hand back there and you felt a bunch of, mappy hair from a ton of blood, someone would naturally go right to the ER at that point. But you can imagine as the exterior signs are not there, you're going to spend more time trying to evaluate, am I okay? And you don't know, you were out for an hour. Of course, you aren't okay. But as you're sort of piecing that together, the fewer external signs you have, of an indication of an injury, obviously, the less likely you might ultimately get to a medical professional. And that's what makes them, and that's why it's good to have these, the ability to find these symptoms and even run through them for yourself. Say, do I have this? Do I have this? And do that type of an evaluation.
Yeah, and again, you're probably not going to be in the right state of mind. So if you try and grab somebody, at least to figure out and see if something's actually going on, that would be ideal. But if you are by yourself, and you have hit your head, it's better to probably go seek a professional more than anything.
Absolutely, that's absolutely yes.
You brought up fighting, so I kind of want to get into that just a little bit. I just want to make sure that I'm right in saying this. Now, once you've had one concussion, are you significantly more likely to have get a concussion once again? And if you fully recover, so like let's just say you had a concussion, you fully recover, and then if you get another concussion, is it going to be worse? Is it going to be the same? Is it going to be, what is that like in regards to just like severity of symptoms after receiving already one concussion?
So the critical feature is if you're still suffering the consequences of a previous concussion, that is, you're not fully recovered when you get that next one. Okay. So if you fully recover, then in a sense, those next concussions, the consequence is not as synergistic. It doesn't necessarily additive effect. So it is critical that you recover. Now, again, as you might imagine, that also means that it's critical we detect it and see it when it's happening. So if you want to use the boxing as the illustration, someone's in there. Boxing is a sport where you're getting a lot of blows to the head. As that's the object of the game is to, you're striking the other person. Right. So even if I don't knock you out, if I catch a blow to your head, you've probably experienced a mild traumatic brain injury at that point. And the odds are that if I strike you again, those are being compounded within the context. I mean, there's a reason why boxers have, one, short careers, and two, they're supposed to have a lot of checks in between rounds and in between fights, and certain mandatory periods of time when they are not getting back into the ring in between fights. And that's really true of, I think, any of those sports where you're fully expecting that injuries like this will occur, because that's what the point of the sport is.
That's got to be one of the toughest jobs in the world, to be a doctor and go up to like a boxer or UFC fighter and be like, "You're good." You're like, "Yeah." And he's just like bleeding and they're like, "I'm going to keep going." You're like, "I don't know if that's a good idea."
Yeah. And, that's a great point, is that athletes in particular, again, we see them obviously on TV and they're televising these things. So we see their reactions. In that moment, they don't want to come out. They want to finish the event. But B, there's adrenaline surging. There's a lot of stuff that makes them very poor judges of what's going on for themselves. And that's why having some objective tests that you can ask them. So it's one thing to say, "Are you okay?" It's probably going to be a pretty automatic yes.
Right.
But having some skill testing questions, if you will, that really aren't that difficult if you have good awareness and you're cogent and clear thinking, that you can answer. That's kind of, anytime you have a suspected injury, in the NFL, when they go take them to the concussion tent, they're supposed to be going through that protocol with them, not just listening to what the athlete is saying that they want to get back into the game.
So there is a way to try to decipher between an overly emotional athlete who's ready to go versus somebody who is, or two, let's say you have two overly emotional athletes. One is, they're actually really good, and the other one is they're actually really injured. There are ways to kind of decipher between the two, because I can imagine there's plenty of NFL athletes who are, or even fighters who are able to be like, "Yeah, I'm fine. Like, I'm good. Let's do this again," kind of thing. And there are tests that you're able to identify when someone is definitely not ready to go back in.
Correct. Yeah. And they might take a couple of minutes, but you can execute those tests and see how a person is performing relative to, their age, their gender, some normative data, as well as potentially to their performance, say at the beginning of the season, if they were given some testing at that point. So you have a few data points for comparison. Truthfully, if once you take someone in there, the default should almost be, if we've been flagged enough to take you in there, the default should be, we've got to prove evidence that they're good enough to go back in, as opposed to thinking of it the other way around. That'd be the safer way to do this.
Yeah.
Because I think, a lot of the injuries and the problems that we run into are usually because it's not so much the incident that happens, the slip, trip, or fall, the sport, whatever. It's really the mismanagement of it after the fact. If we manage it correctly, if we measure it correctly, if we then do the proper response to that, then we can safely participate in these events. But if we're not doing those things, then you get a lot of mismanagement, and you have to recognize that the players aren't going to tell you necessarily. Other contexts, yes, you get into a car accident, someone hits you hard. If you think about it, the motivations are very different at that point. You don't want to miss anything, because at that moment, you're not even liable. Someone else is liable. So if there's an injury, whereas, an athlete, they want to be in the game. And so they're going to downplay those symptoms and such. So the circumstances of the injury also go a long way to determining how much information you're going to get from them.
Sure. Well, an arching theme with concussions, you are able to recover from them, thank God, right? If it's mild enough, you're able to recover completely. In the same way, the body is able to, get stronger, and the ability for the body to become more resilient. For anything, it's just a true foundation of the body. If you work it out, it's going to get stronger. Can the brain become more calloused in that way, and that it can become less susceptible to concussion? Like if you have one and then you recover and then you have another one, is there an ability for the brain to maybe just become more stronger and be less or be preventative and not getting another concussion, so to speak?
Yeah, that you're sort of suggesting like an inoculation model almost.
Right.
I would say again that those data are a little unclear. So far, the data suggests as you have more, it actually heads you in the other direction. But there is some interesting lines of research looking at things that might help minimize the type of injury you might have. So for example, there's some researchers who look at strengthening neck muscles and mobility and such that the actual injury itself is either less likely to occur, or if it does occur to a lesser extent. And so you can imagine safety equipment the same way, works the same idea to try and lessen the likelihood that it would occur. I mean, there's a reason why in some contact sports we put helmets on people and such, because the goal is not to knock them out. Obviously a little different in some sports, but certainly in others, we want the game played, but not necessarily the incidents. And so they changed rules as well. We've been talking about the NFL, the whole idea of leading with your head. If you go back a couple of decades, everybody tackled that way. Thankfully, we've started, changing those rules. They came up with what's called heads up football, where, there's proper tackling technique with your head up. And they start training that at the youngest ages, which is critical because, of course, if they learn it there, that's their natural techniques getting older. So there are safe ways to do this. You use your shoulder as opposed to your head, and not treat your head or your helmet as a weapon, for example. But you look at some old tapes, you can see that's exactly what people were doing all the time, and that was perfectly legal. Right. And so, again, this is an evolving thing, and if we're good about it, we can preserve sports, we can preserve other activities, and get better at doing it. Even the amount of time that they have. Especially, well, they do it with pros too, but especially kids, how much time they have with live contact versus drills that don't require live contact. Even that just makes sense, because obviously if you're doing full on contact all week and then you have a game, that's a lot of opportunities for those types of injuries to occur. 90% of the practice, the truth is, can occur with pads where you're going to the spots, you don't actually have to have the active hitting drills. And you might do that, 20 minutes a week. They have different regular times that they would set aside for doing those types of drills, so that you still get that skill, but you don't need to have it the entire time someone's practicing.
Yeah, and they do that with other sports too. One thing that I know that the UFC and some of the other boxing people, I mean, there's not really like better technique when you're fighting somebody, right? But it's like making sure you're taking less blows outside of the ring, and some of the sparring stuff. And so just trying to minimize that as much as possible. So no, I just found it fascinating. I always wondered if the ability I know the body is amazing. And as a physical therapist, it's been, seeing some amazing things where people don't have rotator cuffs and bring their arm overhead, and just amazing other things. So I was always curious to know, what the brain power was like, and if there was an ability for that to happen. But obviously, as more research comes up, maybe there'll be something out there where there is some kind of preventative thing in addition to neck strength, but maybe there is some kind of, I don't know if it's maybe a supplement, or there is some kind of way for the brain to be more resilient to head injuries if you're going into a head contact sport or something like that.
And certainly there are people looking at those very things, like you mentioned, supplements as one example. So that is definitely on the docket, but certainly well outside what we would consider sort of mainstream given knowledge at this point. This is something that's definitely on the periphery. Hopefully, yes, that information will emerge.
Well, what we've been discussing a lot is the relationship between, finding symptoms, and then also the relationship between coaches and, patients, and you identifying symptoms. And one thing that someone that you've been working with is Sport Gait, and Sport Gait has been really trying to etch itself within this concussion area. But for people who don't know what Sport Gait is, maybe just give a brief description of what Sport Gait is, and then also what area they're trying to niche themselves in the whole concussion realm.
Sure. Yeah. So this company essentially is a sort of a concussion management tool, and it's not a test. So a lot of people, when we think of Sport Gait, it itself is not a test. The philosophy is that it's a platform, and in fact, that's kind of where our work at the university came into this. Is the Sport Gait battery was really created from our research. So we basically looked at, well, what if you were going to put a screening tool together to identify, not just diagnostically, but perhaps more importantly, to guide things like return to play, decision making, etc. That was what we did. We went out there, we scoured the scientific literature to see what are the areas that are affected, what are the measures that exist that can measure those things. And in some cases, we took measures that were already in that field, like the National Institutes of Health 4-meter gait test. It's a test that's available in the National Institutes of Health toolbox, great norms, et cetera. And so we pulled that out as one of the measures of gait. The balanced error scoring system is something else that's been out there for a long time. A lot of good data on its effectiveness, its test reliability, its ability to measure things accurately. And then in the cognitive realm, a lot of the measures that were developed specifically for concussion weren't doing real well in the literature. When you look them up, they're kind of getting battered and bruised. They're getting concussions themselves from the scientific literature. So we kind of went a little outside of that and found a measure that a company up in Canada, Multi Health Systems, makes, which ironically has gotten popular. It's called the Continuous Performance Test, and it's gotten popular as a measure of attention deficit disorder. But when the original version of these continuous performance tests were first developed back in the 50s, it was actually to measure mild traumatic brain injury. It's just they kind of caught into a market and got very popular, and so everyone started making them for ADHD measures. But they were originally actually developed for MTBI. So we kind of went back to the old school and said, well, if these things aren't working, let's try this one out. And it turns out it works really well, a lot better than, much better, in fact, than the other instruments. So we sort of cobbled this together from the scientific literature. And what we did, we established a consortium and then started testing to see how they'd work together, because it was the first time that they sort of put all of these instruments together. And they really work well. And they work well first because they're tapping different areas. So a lot of concussion assessment tools are like one-point solutions. They do cognitive, they do physical movement, but they don't necessarily capture gait, balance, and cognitive functioning, which, again, all our experts tell us, yeah, you got to get at all of those things. They also work well because they have the basic psychometric properties, which all that means is when you give a test, for example, you need to have a test that is going to give you consistent scores in the absence of anything else happening. So if I was to give you a test, let's say a blood pressure measure, if I measured it now and again in 5 minutes, if those scores are wildly different and you're just sitting there, that would be a problem with the measure. It needs to give us a consistent score. Well, even just that most fundamental thing, a lot of tools that are used out there don't have particularly good, what we call retest reliability. So just getting tests that can provide us that, so we know we're measuring what we think we're measuring, we can show that it predicts important outcomes for concussion. That's what we've been doing. That's most of what our work has been, is putting together a battery and then evaluating that battery. And we've been doing that for the last 6.5 years now, with partners in medical facilities, other universities that have been contributing data. So that's kind of been our and then what SportGait did is they basically commercialized it. So they took this battery, they did a great job of putting it in a system that's very user-friendly. So you don't have to be an expert in any of these, essentially, to be able to implement them. And then they built it with essentially good user-friendliness with their technology, the app that goes along with it that has the CDC concussion symptoms. So if you experience a hit or your coach is staying there, they can go through them and essentially turn this into something that pushes the decision to a medical professional as needed.
So it's a platform that basically brings all the symptoms and the progress of a concussion patient or athlete all onto one platform. And who are able to see all this information? Is it just the patient? Is it the parents? Is it the providers? Like who's allowed to access this information and on the SportGait platform?
So there's a couple of different pieces that I kind of glossed over. So part of what I just described is what we call our medical platform. So that's the part that a medical professional would be using. There is a phone version that then the athlete could do, or the parent, if the person's under 18, could run them through. That would be something you see or your parent sees, and you would have to then give permission to a particular doctor or someone to see. We have an athletic trainer version, which is another app that has a few more features and lets them do a little more investigative work than the self-assessment. But again, the athletic trainer, presumably if you're on their team and they're your AT, they're cleared to work with you, but they then have HIPAA compliant protected information that can move from each provider. So it's all sort of, I think they refer to it as an ecosystem that has all these different, you have the athlete, and then you have all the different providers, parents, etc., leagues. So if you think of a team or a league that's trying to do concussion education, that's built into the app as well. And you can see who's done it and who has not. And it sort of keeps all that record as well, who's been cleared and who is still in return to play. So that's really where the technology merges with the science, so to make this kind of a seamless process, but essentially it depends who you clear to see it. And of course, if you're built into a team, that team is all part of that HIPAA bubble, if you will, of protected information.
So every hand in the pot has their own portal, and they're all looking at this one person, and they're all able to see like what's going on. So like the evaluator is able to input data. The athletic trainer maybe is also allowed to input some of their data, and then patients and parents and coaches are able to see that information in an easy to presentable way, so that way they can identify whether I'm good or I'm not good, or, these are the things that I still need to work on. And now, are there things within the app or in the platform that patients can do? Like, are there little exercises like brain games that they're able to do to help recovery?
So currently they're not built into the app per se. The way it's built in there is if you're in, say, one of the, so if the doctor, let's say, says, yeah, you're out of sports right now, but you're in a return to play protocol, it'll push the CDC return to play protocol to you. The doctor can also tailor it a little bit specific to whether it's your sport or your unique scenario. You've injured your ankle as well, so they'd have to modify it a little bit. Those instructions all come. Now, the actual, physical therapy you might do or cognitive therapy you might do, that is not currently a feature in the app, but you can do reassessments on the phone version of the app, and that information can be pushed to the medical professionals that you're working with, athletic trainers, all of those interested parties. So you can at least see, as someone is going through this, are they improving? Are they not? Are they staying the same? So the app is really built for the education and the testing. The interventive is the model would be whoever's working with you that would direct, as mentioned. I should also say the phone app does also have mood ratings as well. So again, to look at things like anxiety, depression that often occur as a consequence of a concussion as well.
Are they having a hard time? Are people having a hard time understanding this data? Are people having more questions? Does this and is there an ability for patients to reach out to their doctor through the app so that way they can communicate with one another?
There is. And I will say one of the things that probably has impressed me most with this company is the person who does their technology, their CTO, has really done a nice job as we've sort of talked through what the scores are, et cetera. Is a real gift for making this information really user-friendly for both doctors who aren't necessarily experts in concussion when they're looking at this, and also for patients, coaches, et cetera. So really user-friendly, using some color coding, green, yellow, red, to help folks kind of understand where you stand on the spectrum of injury and recovery. So in that regard, I think people will find it a very user-friendly tool when they use it and look at those scores.
Now, in order to track progress, do you need to do everything beforehand? Like, would the ideal scenario be you test all your athletes prior to with Sport Gait, and that way, if there is a head injury, we have a normative before data, and you can have a after data, so to speak?
Certainly, if you have what's commonly referred to as baseline data, that can be helpful because obviously that's pre-injury data. However, as people are going through recovery, so let's say you had an incident, you come in and the provider runs you through that system, and then you maybe do some additional tests on your phone, and then you come back 2 weeks later in the office and do another one. Those data are all identified with little pins, and they're numbered so that you know which one was the most recent, which one going back. And so someone can use that information, even if you didn't have pre-injury information, to still track how you're doing since the injury. If you're generally heading back towards the norm, meaning how most people your age perform, or are you stagnating or even getting worse? So in that regard, those conclusions can be made under really any circumstances. If we have baseline data, that just gives us some additional information. It's particularly helpful to have baseline if someone was performing unusually before their injury. So imagine if you were particularly poor, let's say at one, balance measure, or if you were particularly gifted in one area, because that otherwise might get masked. Meaning, if I didn't have your pre-data, I might see, your balance is really struggling, not knowing that you were perhaps not particularly good at balance to begin with. Or let's say you were really gifted cognitively, that might hide or mask, because I might look otherwise and say, oh, you're about average, but the reality is you were 2 standard deviations above the mean beforehand.
Right. Yeah.
Right. So it does give us more help for people who fall to the outside of the normal range up front. But again, as you test someone repeatedly, presumably we would see scores improving in those directions and changing as a function of recovery time. So we kind of get there eventually, but certainly if you had that baseline data, it would be helpful.
Now, have you seen recovery time improve since Sport Gait has started? And are people generally more, do they get better if they are more aware and like basically on top of their health, as opposed to somebody who just kind of like waits a little while and goes along with it?
Yes. So one of the best ways to have good recovery essentially is to be measuring it well, so that you know what sort of if interventions are needed or if the person's ready to go back, and to be really precise and sensitive of that information. So one of the things that we are seeing, I wouldn't necessarily say it results in people going back quicker, because obviously if you have a more sensitive measure, it might actually slow down some returns early on where, let's say another instrument's not as sensitive, and I say, yeah, you're good to go. But if you think of sort of the season-long or the career-long experience, then yes, we expect that to be the case. Obviously, it's new enough that those data are not yet available, but the ability to say, look, this instrument would have cleared you, this one's saying you're not quite there yet, and so that holds you from going back a week or sooner than you would have, or the long-term consequence is that week when you would have been really vulnerable to that second hit where you're not fully recovered is less likely to occur. And that's better for your, not really just, I'd like to pull this out of thinking of you as an athlete, but thinking of you like as applies to 99.9% of the people, which is you're someone who's doing athletics now, but you're likely to just going to be a non-athlete for the rest of your life when you're computer science person, an AT, whatever job, and you're going to need your brain for those things, as opposed to, when you're playing peewee football for a few years, living your glory days, but that's not, or high school football, whatever sport we're talking about is obviously not unique to that. If you're a cheerleader, that's actually one of the highest incidents of concussion for women is cheerleading. Which, by the way, also highlights how most of these injuries are accidents, not intentional, because when they come tumbling off those pyramids and things, as you might see with cheerleading, a very dangerous sport for obvious reasons. But same idea there is, sitting out that week probably is going to be important if that's in fact the case.
Which, of course, you need your brains for the rest of your life. So it makes complete sense. And I'm sure athletes sometimes don't want to hear it. But again, it's like the chances are you're going to need your brain more than you need to play this game this week. It's going to be not as important.
Yeah. And in fairness to, to the people, of course, if you're not, if these symptoms are subtle enough that these measures are picking up, but you're not necessarily feeling them, you can see why they would say, yeah, I'm ready to go back, and not really realizing, you're really vulnerable right now, and it's just not worth that risk. And you can also see why some people choose not to make it. Hey, I'm in the NFL. I got an average 3.2 years of career. I'm in the Super Bowl. I want to play. Well, that decision by an adult is a very different decision than a parent might make for their kid who's playing, some rec soccer league on Sunday. Probably you should err on the side of being a little more cautious, because that's not going to be the breadwinning. That's not their life. As important as that might seem at the moment.
And it's great because SportGait can provide you information to make you have parents, coaches, physicians, and athletic trainers all make a better decision for those athletes, or even for regular people. Maybe you just have a student who accidentally hit their head or something like that. Yeah. This data can be really important to help make industry drive decision making, so to speak.
Yeah, information is the best way to empower people, because I'm sure that if you go back to those parents or even those athletes and say, if I had known this, would you have gone back? And say, you know what, I'd probably taken that week off would have made sense, right? Or at least that couple extra days. And I think giving that perspective, that information really empowers people to be able to make whatever decision is made, because this doesn't necessarily dictate this one decision or another, but it does provide you with the type of information that you would hope would lead people to make better decisions in the long run.
Since you've been working in concussion for so long now, and you've been working with SportGait as well, I guess, what has probably surprised you the most in regards to just concussion research, maybe, or even like recovery? Again, what's probably been the most surprising thing to you more recently about concussion and head injuries?
It's a great question, because each week we sort of get surprised by different things. I will say, when I first started, I was surprised by how poor some of the most commonly used measures are. That really blew me away. That, as I said, that concussion specific literature was not something that was familiar to me. And as I got into it, I really came out thinking, why are people using these measures? Are they not reading the literature? And of course, that's often not the case. Someone who's practicing isn't reading the journals. And so just the disconnect between what we know in science and what gets practiced. So that chasm really shocked me. I have to admit, I was also surprised at how well these instruments that we sort of put together based on the literature then started working, because I kind of had a skeptical approach, thinking, well, maybe these things can't be measured that well. But as it turns out, you just sort of use some common sense literature. Again, this isn't science we were doing at this, but this was just looking at what other labs are doing. There's surprising uniformity in what works and what doesn't. And so when you put together what everyone says should work, lo and behold, it does work. And so really it's that movement then getting this into the clinical sphere. And I'll tell you then the third surprise, and that is it's hard. Inertia is a powerful force. So when you then come back and you get a lot of people who go, yeah, we know this thing doesn't work, but we've been using it for 10 years. And there's it's like, tipping the Coke machine. It takes a while to it's not that, oh yeah, let me just switch and use what's clearly a better instrument. It's a tough one. And again, I understand it, whenever we get into our little routines of using something, it's hard to make that change. So those are probably the three biggest surprises, and they're all on this continuum. And we're kind of on that backstage now where we're, people are acknowledging the science, they see it, the papers are coming out, but not necessarily running to make a switch. And it's a confusing time, because instruments are popping up left and right. They think, hey, there's like a money grab. They're not necessarily well established or scientifically vetted instruments, but it leads to a lot of confusion in the field, because a doctor or whoever's going to make that call isn't necessarily an expert in the science. And so they look at all these flashy things and think, oh wow, this looks pretty good. But if you actually look at it, either the science is absent, or if it's there, it's not particularly good. And that's the advantage of, I think, adopting a sort of a platform approach, because the fact that the literature tells us these instruments are the ones to use right now doesn't mean that 5 years from now, these are still going to be the best instruments. So having a platform where you can go, the literature is starting to emerge to tell us this should be used, then you can make those changes either as an addition or as a substitute in other words, you don't want to get married to an instrument. Mm-hmm. You want to get married to the process of finding what works. Yeah. And if you continually keep doing that, then you'll always use what works. It may not be the instrument you use. In fact, I'd be disappointed if 5 years from now the battery hadn't changed. That would probably suggest we're not doing something right, I would think, because we should be able to improve it.
You're right. And that idea of trying to find like enjoying the process rather than like being married to one idea is just like good science, right? Like I find it interesting that, we always want to go back to the foundations of a science principle. And you always want to be skeptical about like what's new and emerging. But at the same time, one of those things that someone might be curious about might be the answer that we're looking for. Yeah. And it's something that we always have to be not be optimistic about, but don't throw the baby out with the bathwater, right? Yes. And it's like, it's something that you got to delicately balance, where again, you've got to stick to your foundation, stick to your principles. Don't be completely negative towards whatever, is coming out, but definitely keep an eye on whatever's new. And then if more data comes out, then don't be afraid to throw out your things that you already, what you thought was to be true, right? Like just don't, working on both continuing spectrums.
Yeah, it's a delicate balance. I mean, it's one of those things, and a lot of times people lean a little more one way on hanging on to things, or other lean a little more the other way in terms of adopting some new things that come out. And each person has some preferences there, but certainly the most dangerous person is either the one that's jumping to the flavor of the week, or the person who's just never got their heels and they're never changing. That's a problem. You got to be listening to that to that literature as it evolves.
Right. I always heard this. It was this, I forgot where I heard this from or who exactly said it, but it was basically just like all the answers to everything that we know are already answered, right? Like life is what it is. And it's just like our jobs as humans to try and figure it out. And it's like within that confine, it kind of gives us this idea like, okay, like what we're describing, like don't get married to what you know before, like knew before, and then also be curious to what's in the future. Cause again, we're just continuously striving, trying to figure out what all the answers are.
Yeah, and you can see also how there's different players involved in this. I mean, obviously, if I come to you from company X and I'm a salesperson for company X, my job is to sell you whatever company X is making, not necessarily to actually answer the question, is this the best instrument I can use?
Right.
So, not to get on the soapbox, but one of the advantages of working in these academic environments where the goal is to learn truth, if you will, to figure out what's actually occurring, that is an advantage of this type of partnerships that we see with these some of these university consortiums. Is this isn't the company that's doing the work where you always have to be a little more skeptical. Does that work replicate elsewhere? And so that's the whole point. And that's why we're always trying to grow our consortium. We're not sitting here saying, hey, we're secretly doing all this research. When we put out our papers, we say, contact us if you want to join our consortium. We love to have, because one, our data get bigger faster, but two, it's kind of a transparency. It's like, the concussions you're getting at your clinic, at your university, at those are the ones we want to learn about. So, join our team. We study all of these data together. We actually invite people to be authors on a lot of our papers and such, to be involved in the process. And I think that's how we learn and keep making this a better and better process.
Absolutely. And growing together, right? Like just bringing everybody together and making sure that we're all trying to do the best that we can to help the patient at the end of the day.
Right. Exactly.
Well, listen, it's been great to talk to you. I honestly hope today's been helpful to not only just a layperson who doesn't know what a concussion is, but maybe a clinician who wants to learn more about concussion and kind of just understand the foundation of what it is, but also, hear about this new company and what SportGait is trying to do from a concussion standpoint and trying to educate patients. So thank you again for coming on the podcast today.
Absolutely, Michael. Thank you for having me. I enjoyed it.
Of course. Just to finish things off here, I just ask all my guests these final 3 questions, and this is going to be the health me to health you portion of the podcast. So the first question I ask you, like I ask everybody, is if you had the attention of everyone in the world for 30 seconds, what would you say?
We often underestimate the types of damage that can occur to our brain because we don't see it with the naked eye. And as a result, we tend to rely on ourselves, our own self-assessments, et cetera, of what that damage might be. That's probably one of the most dangerous games that we can play with our brains. And we know this, whether it's figuring out if we have advancing dementia when we're older or when we're younger and we have incidents like concussions and things like that. So the ability to sort of rely on something objective, something that's user-friendly, something that's available to us is really critical. And we should always avail ourselves to that information. You'll still have the decision to make, a parent, child, whatever the case may be, of what you do with that information, but you don't want to make those decisions in the absence of that information, because then, you really are left at luck to make the right decision. You want to at least make it with the information that you have at hand. So that's probably the 30-second message I would pitch.
Informed decisions over guessing. I like it. Right. Second question, what book do you recommend, whether you're reading now or in the past?
I recently read a book by someone who we've been working with on the SportGait team, Merrill Hodge. He and a physician, Peter Cummings, put a book together entitled Brainwashed. And it's actually a really interesting book. It's not the typical concussion book, but it sort of talks a little bit about how essentially, I think I've referred to this earlier, that we often mismanage concussions. And if we learn about them and learn to understand them better, then we can essentially manage them and be safe in the activities we do, the sports we play, et cetera. The answer isn't necessarily just say, well, you should never do X, Y, or Z. There are safe ways to do many things that we engage in. Obviously, the bias here with Merrill being one of the authors, he's specifically talking about football. But I think it's actually a really interesting read. So I've enjoyed reading that. I'm not quite finished. I got a chapter to go. So
last question, where can people learn more from you, and then also SportGait?
So as we do research, we kind of upload it onto that SportGait website. So again, for full transparency, we put our work out there. So I think it's sportgait.com, I believe is the web address. And we have all of our papers and work posted there. I'm at the University of North Carolina, Wilmington. So folks are certainly welcome to contact me through the university as well. And certainly if there's any listeners that are run clinics and such and want to be involved in our concussion consortium, we do run all the institutional ethics through the university here, and we add institutions as they are interested in joining the consortium.
Awesome. Well, again, thank you so much for coming on the podcast today. I really appreciate it.
Thank you, Michael.